My name's Mary Gugan, and I'm sitting here with my friend Dr. Ashit Syngle in Chandigarh, his marvelous office, where he has guided me through a long journey of severe rheumatoid arthritis. And I had a question in my thought about to ask him where his inspiration and his understanding of arthritis and his particular power of healing came from.
I think I have always been interested in helping human beings, right? Perhaps from my childhood. But when I joined medical school, I was particularly influenced by people who were in pain, body pain, joint pain, muscle pain. And at that point of time, unfortunately, our system did not have much to offer to these patients. But I was fortunate when I entered my formal specialized training. This branch really came up, and I was very fortunate to enter this branch when a lot of new research and new treatments came up.
And did you find that exciting and challenging on an intellectual level?
It's very exciting. It's very because it's an ongoing, growing field. There is research every day, new molecules coming up, and we also do some of our own research, which we have presented abroad and which has also been published from abroad actually.
Well, my personal experience of you, Dr. Syngle, is that you have an inquiring mind and a decisive intellect. And I think in a true healer, that's important, because then he can take in the whole person, plus integrate all of the new methodology in. And I've certainly found that that's my direct experience with you. I was wondering if you could explain once again to me all the symptoms of arthritis that someone might experience but not be able to identify.
The common symptoms of arthritis are pain in the joints, swelling, stiffness, particularly early morning stiffness. Sometimes people can also get fever, skin rash, dryness of eyes, mouth. These are the common symptoms which normally a person comes with. But occasionally people can have lung problems, kidney problems, and blood vessel problems.
When should a new patient think, possibly I need to see a rheumatologist? At what point would be good for him to make an appointment?
In today's world, earlier the better, but joint pain, swelling or stiffness of few weeks duration calls for a rheumatology consult.
Now, I'm someone who came to see you about 18 months after it started, and I was a sad case then, not now. And what happens when you meet someone like me who's come late?
To be honest to you, Mary, it's very rewarding to treat patient at any stage. You know that better than I do.
Yes.
You know that better.
Yes.
It's very rewarding. At whatever point patient comes to us, we can control the disease, give him pain relief, relief from swelling, and definitely a better quality of life.
And in your experience, what beyond the medicine and the relationship with the doctor, what are the important points that a patient can do for himself at home, within the family circle, and how can the family be supportive of a person in
I'm very glad you asked this question, and it's very important. See, the person needs to take charge of the situation, to participate in the treatment, to keep a positive outlook. They must have a good relationship with their doctor, realize that there is light at the end of the tunnel. Initial few days or weeks may be a little problematic, may be a little painful for the patient, but ultimately there is light at the end of the tunnel, and if they have good family support, good nutrition, exercise and a positive outlook, they will reach their destination.
Beautiful. So Dr. Syngle, for almost 20 years now you've been in your practice, and you spoke earlier about your excitement that you entered a brand new field and how much could be done. When you look back at 20 years, how do you feel about your life as a rheumatologist?
I feel very good and very happy about it. And there are more exciting times which lie ahead of us today.
Well, on behalf of all of your patients, I want to thank you so much for your dedication and for your love for each one.